Well, good afternoon, everyone, or good evening or good morning, depending on where you are across the globe. Welcome back to SADS Facebook Live, the 25th episode. Many of you and I have been together since February in the midst of COVID-19 pandemic. So welcome back, or welcome for the first time, and I'm really glad you're here. I'm Mike Ackerman, a genetic cardiologist at Mayo Clinic, and have the privilege of serving as president of the board of the Sudden Arrhythmia Death Syndromes Foundation. And on behalf of Alice Laura, our CEO of the SADS Foundation, thanks for joining us. And we are glad you're here. And I'm really glad that I'm joined by my colleague, Dr. Shannon Hourigan, a pediatric psychologist at the Boston Children's Hospital and their inherited cardiac arrhythmia program, a program that I know well. And so Shannon, welcome to the program. Thanks so much for joining us.
Thanks so much, Mike. It's a pleasure to be here.
Yeah, I'm looking forward to what we're going to talk about. But before we do, I need to give our friends in Facebook Live land an update. So many of you know we're at 21 million cases of COVID-19 worldwide. Not a great number. Don't like that. 760,000 deaths in the United States. We have just hit 5.3 million cases and 167,000 deaths. Maybe a little good news, maybe. I guess we take excitement in small measure. You know, July was not good, where we had over 60,000 cases basically every day in July. Since August 1, August has been a better month. We've been under 60,000 cases every day in August so far. Last week, we touched on back to school issues. That's going to be a continuing topic, and we might touch on it again today. I'll give you a quick update. My son, who will be returning to Baylor University, leaves on Monday. So they're still on. School starts August 24th. Our daughter, which I mentioned, Mayo High School in Rochester, Minnesota, they decided after our program last week to move to online learning for the first semester. So these are new changes. We're going to be rolling with things, and Shannon's going to be helping us with how do we roll with all this craziness anyway. So go back to that program last week. Some of it's already out of date. 2 weeks ago, Peter Schwartz, remember that? Pass that tweet, retweet, send on that interview. That was a great interview with one of the true legends of long QT syndrome, Professor Schwartz. So look that one up. And then 3 weeks ago, July 24th, our most watched SADS Facebook Live interview with my infectious disease colleague and next door neighbor, Dr. Stacy Rizza, as we talked about the state of COVID-19 from an infectious disease perspective. Over 10,000 views from that program alone. We're over 85,000 total so far, so hopefully we're doing good. But now it's Shannon's turn. So Shannon and I are going to chat about her role in genetic heart rhythm care and many things about mental health, emotional well-being, because we have said from day one at the SADS Foundation that our goal is to help equip families to live and thrive despite their diagnosis of long QT syndrome, Brugada syndrome, CPVT, whatever the name of your genetic heart rhythm condition is, your genetic heart disease condition is, we expect you to not only live, but to thrive. And so Shannon's going to help us do that. And from wherever we're at, do it better than we're currently doing. So Shannon, let's get started. What is a pediatric psychologist anyway? What do you find yourself doing for the team at Boston Children's Hospital?
That's a great question. So I am a trained clinical psychologist. So a psychologist is somebody who, after finishing a bachelor's degree, went on and achieved a master's and then a doctoral degree in the study of psychology. And so as a clinical psychologist, I'm somebody who has lots of education and practice working with families and really understanding things like anxiety, depression, family behaviors, the way that we learn things, child development, all sorts of things. The pediatric psychology specialty of that means that I'm somebody with some real focused expertise and specialization in the way that all those emotional and behavioral kinds of things that can come up with families intersect with a medical diagnosis or medical, medical concerns. And so as a pediatric psychologist in the inherited arrhythmias program, so I sort of get specialized, and we call it ICAP. So that acronym, I might say ICAP. So as a pediatric psychologist in that program, I work with families who are coming to us at all different stages of understanding their diagnosis. So the kinds of different things that I do include, helping families cope and adjust to, understanding, to coming to the understanding and recently receiving a diagnosis. I work with families who are struggling with grief, having recently, lost somebody. I work with families along with our amazing genetic counselor to think through questions about testing. I work with families and kids around preparing for procedures. So kids who are getting ready for, to have a device implanted. I work with families to prepare for those kinds of things. So what I do really runs the gamut.
Great. Thanks, Shannon. And for those of you who have joined us, welcome. Hello to Ireland. I love there. Dublin, I've been there once. Would love to come there again. I actually met Dr. Ward of Romano-Ward syndrome and had dinner with him in Dublin, Ireland. So one of the highlights of my life, Dana. So thanks for joining us. But Shannon, you mentioned pediatric psychology. You mentioned our world of inherited cardiac arrhythmia or genetic heart rhythm diseases. What have been some of the unique mental health issues that you think you have encountered in our population of patients? The families that I've had the privilege of taking care of, these are incredible families, but they do have some unique challenges because of their genetic heart diagnosis. What, from your vantage point, have emerged as some of the 1, 2, or 3 most distinct challenges that might be because of their diagnosis?
Yeah, the way I think about it, Mike, is, the families that I have the pleasure of working with, are families who have already been through so much. Our families have often experienced really profound and unexpected loss. And one of the things that I think that our families can be vulnerable to is, there was the way that, the sort of the pandemic has sort of unfolded in a lot of places, at least in the United States, with having sort of a sudden and very quick, cessation of, and this is very particularly true in Boston. I recognize, we're different all over the US, but, having a very quick and sudden sort of end to school and end to things. I think for a lot of our families, some of the very sudden uncertainty and loss has really brought up some unresolved grief and pain and trauma from some earlier, from earlier losses.
We have 2 different kinds of families, don't we, Shan? We have those where unfortunately tragedy is already struck.
Yep.
Before we could make the diagnosis and meaningfully prevent death.
Yeah.
And then we have those other families where thankfully nothing bad has ever happened, and they're trying to gauge how bad this is because they might be going on Google and getting the perception that long QT is going to kill people left and right, which it doesn't, or that COVID-19, the virus is lurking around the corner and is just waiting to infect your heart muscle, which it doesn't. So how do you help them acknowledge what are these uncertainties and these anxiety-provoking situations and press through them? What are you doing when you're working with them?
Absolutely. That's a really good question. So the, uncertainty. So there's a few different parts of that. One is sort of thinking about how do we deal with uncertainty sort of globally, but in terms more specifically about, thinking about when families are struggling with things like, is this going to, COVID is right around the corner. If I open my door, if I go out to get my mail, I'm going to get this and we will most certainly die. It's a lot of it is really helping families unpack and make sense of the really kind of complicated information that's out there and helping them understand what are the things we can do to reasonably keep ourselves quite safe and keep others around us safe. But in terms of coping more broadly with uncertainty, really thinking about, and uncertainty is something that our families are dealing with. It's something that families everywhere dealing with. We don't know when a vaccine is coming. We don't know when a lot of things are happening. And I think parents are often in a place where, I know this as a parent myself, is where I often want to provide that reassurance. I want to help my kids understand that, everything will be okay. That's such a foundational part of being a parent. You want to let kids know that they'll be okay. But it's hard to do that when we don't know exactly what the future holds. And if we think about it, we never really do. And so something to think about for our families and really for all families is in terms of thinking about uncertainty. As parents, we don't have to know everything. It's okay to say to kids, if they say, is school going to be open? Am I going to be able to go back to school? If you don't know as a parent, it's actually a good thing to say, sweetie, I don't know yet. The scientists and the doctors and the principal and all the grownups in this town were working on figuring that out, but I'm just not sure yet. But what I know is that all of the grownups were working really hard to make sure that everything is as safe as possible for everybody. And so as soon as I know, I can let you know. And that's not, go ahead.
Yeah, no, I was just saying that's fantastic. And I was just thinking I see on our Facebook Live, I want to welcome Leah, where this is a new journey for her, and she was just diagnosed, and her daughter, and Sherry, welcome to SADS Foundation. New for them as their two boys just were diagnosed, her two sons, or two of her sons, in September. So for those where it's new, I think you see in Boston what we see, the anxiety meter at the beginning is really high.
Yeah.
And then as they get equipped with, I would say, knowledge is power, that can be very anxiety relieving as they start getting more correct messages that, you know what, we're going to do well with this. When we know it's there and we've made the diagnosis and we put in good treatments, death is just not going to happen. Now, there are tragic exceptions to that statement, but very few. So when we can get them over do I have to go check on them every night because they might die tonight, and realize that we're going to do this well, we're going to win, we're going to succeed, then they can start to move on to that next step of, well, then how do we start living then if I can move the goalpost where I don't have to think about the victory being preventing death, but now victory can be living life large. So how do you help them move through those stages?
Yeah, and I also see too, there was a question about, anxiety and how do anxiety and panic attacks affect long QT, right? So, so really thinking about, one thing is that I do with families is I really do a lot of what you just did there, Mike, is really try to normalize. It's a really understandable fear and thought that we have, as parents. Oh my goodness, so I have to go check on him every minute, like I can't sleep. I have to watch the monitor constantly. That's a pretty normal thing. I think every parent can relate to at some point in being a parent. So being with parents around and normalizing that is a fear and a thought that families sometimes have, but recognizing the difference between thoughts and facts, right? We have thoughts, and thoughts are guesses, right? I might have the thought that, Mike, you're wearing just like a beautiful pink polka dotted shirt. That's a guess. That's obviously not true. You're not wearing a pink polka dotted shirt, right? But just because I thought it, well, I don't think so. But I mean, my thoughts are guesses. I think that's blue, but I could be wrong.
But I'm colorblind, so you could be right.
I didn't realize that. I wasn't trying to poke at your colorblindness. And so helping families really recognize that, it's not, that's an okay thought to have, but that you're actually quite safe, and helping families recognize that if they, that not checking, doesn't increase that risk of anything bad happening. Now, the question about, how do anxiety and panic attacks affect long QT? You're certainly the one who can answer how something might affect long QT, but the way I see it interacting is that oftentimes folks who have a vulnerability to anxiety or panic can then become very focused on what they're experiencing in their hearts. And the more we pay attention to something, if I start talking about my ankles right now, this is something I like to do, is I start talking about ankles. Now, nobody who's watching this is probably thinking about their ankles before I started talking about my ankles. I'm noticing my ankles are warm because I'm wearing some nice fuzzy slippers under here. And, and I'm noticing that my ankles are crossed. I can feel how they feel. the more we pay attention and talk about something, the more, the more attention we bring to it. And so what happens with folks who have panic and then, experiences with arrhythmias is they start attending more to their hearts, which then increases anxiety, which then increases heart rate, and a loop can start to form. So if that's something that families are struggling with, then talking with families about, talking to their pediatricians, finding a psychologist or a licensed mental health provider in their communities, and working with someone around coping with some of those symptoms.
I think that's a great point too, in the sense that it's okay to acknowledge if you're having anxiety, but to realize that probably in general, almost for every health condition, the more Hakuna Matata, that's from Lion King, everybody, a trouble-free, worry-free philosophy, the more Hakuna Matata we can be, we probably do better with virtually any disease that we have, don't you think? Or is that, it might be a way to Lion King?
I mean, the Lion King's amazing. But, thinking of, recognizing that sometimes where we get ourselves into trouble as people is we will start to try to fight with those symptoms of anxiety. We'll start to try to get rid of those symptoms or avoid anxious thoughts. And, the more research that's done, the more it seems like, if we really try to do battle with those thoughts, and combat them. Sometimes there's a place for that, and a mental health professional can help with this. But if we just sort of recognize and acknowledge, I'm feeling pretty anxious right now. This feels stressful. I'm not sure what's happening with schools. I'm not exactly sure, what's going to be happening with work. There are a lot of things that are stressful right now. Really acknowledging that and saying, yeah, that's how I'm feeling right now, and that's not a wrong or bad way to feel, but to acknowledge it and say, and I'm still going to do the things that are important to me. I'm still going to go for a walk, make dinner, go play outside, or do whatever we need to do.
So if our families and our patients with long QT syndrome, any of the genetic heart diseases, if I were to put out to them that preventing sudden death is easy for me and is easy almost always for your partner, my good friend, Dr. Dominic Abrams, if our goal was don't let us die from our long QT syndrome, I would be saying you've given me a pretty easy task overall.
Yeah.
So then it becomes more of, if that's true, and I think it's true, how do we win at the thriving part of the equation? What are some things that you would encourage the children listening, the teenagers or the parents in the thriving formula? Do you have like your 3, 4, 5 most important things that these people should be doing regularly if they want to thrive despite being diagnosed with long QT?
Yeah, I mean, it's different for everybody, right? But find the things that really excite you. Find the things that make you feel excited. For some people, it's camping. Other people like to quilt, play soccer, play, paint. There's, find the things that bring you joy and dive into them, spend time with people who you love. That, your diagnosis is part of you, but it's a tiny piece, and it's always there. It's not wrong to be aware of it, but it's a passenger on your journey, right? Your journey, wherever you're going in your life, you're going to those places, and your diagnosis is going to come along with you. But where you want to go, on a beautiful hike, or you're going to find a waterfall, you're going to to ride bikes, you're going to just do whatever kinds of things you want to do, like find those things and embrace them and enjoy, really be able to dive in and enjoy them. And if you're finding that you're really having a hard time enjoying things that you used to be able to enjoy, or that enjoyment's hard to access, that's when it might be time to talk, to seek out a pediatrician or a doctor, a mental health provider, because that can be a sign that you're starting to struggle in a more significant way.
Yeah, and Gina, who's with us, is reminding herself and reminding us that worry is a lack of faith, not always easy to do. And Gina, I share that. I'd be curious what Shannon would add, but you've heard me say many times on this program that be anxious for nothing, worry about nothing. And I try to do that. Some of you, I don't see her on yet, but she sort of patented my hashtag refuse to fear. And I try to live by that refuse to fear. I try to acknowledge things and press on. But what would you add to some of those things that Gina is getting at with how to navigate this worry factor?
Yeah, sometimes worry, our brains are prediction machines. And, worry, anxiety is part of a spectrum. You want to have some anxiety before you take a test. I had some anxiety before signing on here today. I've not done one of these before and was feeling a little bit anxious about it. I didn't know what it was going to be like. That's normal. That probably made my thinking a little bit sharper. It made me, really pay attention. It's helpful, right? A little bit of worry, a little bit of anxiety is okay. Some worry about, well, how will I, navigate the new situation might make you think through things. When it happens over and over and over again, it really starts to interfere. It's interfering with your sleep. That worry isn't, what should I do about that? It starts to become something where you're ruminating, you're really stuck on something and just sort of over and over and over. Those thoughts are waking you up, or it's not getting you anywhere. You're stuck on what would I do if this? What would I do if this? And it's really stuck. That's when that can be really challenging. One thing that can be helpful when we're in these situations that are characterized by a lot of uncertainty, is to find something that you can do to help. Find a way that you can devote your energy to something, right? There's always something that can be done to help. Perhaps there's a neighbor who, who's older and could, maybe use some groceries delivered. Maybe you could bake cookies for somebody and drop them off. Early in the beginning of this, I was struggling with some anxiety myself, understanding all of these things that were happening and trying to make sense of this pandemic. And then I learned about, the benefits of cloth masks as soon as that came out. And I'm a quilter, so I have a lot of quilting cotton. So I made a bunch of masks for all of my neighbors. And then my entire neighborhood was masked really early on because it was that was a way that I could devote some of those energies. So that anxiety feels like it's keeping you sort of on a treadmill of not being able to do anything helpful. Then think about what's something that I could do. What's an action that I can take? And then, try to devote some of that energy. That really helps us feel more empowered. It helps us feel not helpless. I felt energized and helpful and like a giver, and that helps me cope.
Right. And I think I was thinking as you were saying those things about what I would teach as a martial artist in self-defense classes about, our sympathetic nervous system and our adrenal gland and we call it the fight, flight, fright response, right? And those are good reactions. If I get this reaction and it makes me fight, that's a good thing. Yeah. If it makes me flight, that's a good thing. Run from the lion, tiger, bear, oh my. But fear paralysis, if it makes me go there, that's an awful thing. So
exactly.
Which thing is that worry driving me to do depends on whether that worry is a good catalyst or whether it's destructive. And I think people will look at that. And I'll use that to follow up to Megan's question. Megan has a good one. So thanks, Megan. So Shannon, how do you balance between living and having joy, but also being a realist, especially when needing others to understand the diagnosis and be proactive? Where's that?
Absolutely.
Yeah. Great question.
It is a great question. I think if so I'm imagining Megan as a parent, or perhaps a patient herself, and she's wanting others to understand her own diagnosis and making sure that the proper precautions and things like that are in place. Right. So, that might be something that actually may lend itself to that kind of really practical task. Right. So, so maybe for example, for Megan, it's important to make sure that there are AEDs in her school, or in her community center. And she's struggling with getting funding for that or something. There are steps she could take if she identifies the problem as perhaps education. That might be a number of tasks that she could take to help make people understand why this is so important and why it would be beneficial for the whole community. Perhaps it's a fundraising issue and she could, devote something there. And then focusing that energy in a way that feels like it's really, really helpful and really, can really lead to something. And then in the time that you're not focusing on that, really making a decision to separate yourself from those things that can stress you out, right? Maybe it's access to non-SADS social media, perhaps, right? Or the news, turning things off that we notice increase our stress, and doing things that help. So spending time with loved ones, doing those restorative self-care things, and really making time for those things that bring us joy.
Well said, beautifully said, Shannon. And I was just looking over, and I want to, Felicia, great, welcome back. She's saying something great, so I'm just going to quote her. Being grateful has really helped me. So grateful for every breath and waking up every day. My faith has gotten much stronger because of this too. And I think, as a pediatric psychologist, you could probably comment about the power of gratitude, right? Just those who carry a grateful spirit do better and thriving than those who aren't. Anything you would add?
I think that's a great point. As soon as you drew my eye to it, I saw it, and I agree. And I think, Felicia, that you're spot on, right? What you're doing there, you're cultivating this practice of bringing your mind to the things in your life that bring you joy, that bring you that make you happy, that you're grateful for, right? Being able to take a deep breath and waking up every morning, all of these things that you have in your life, taking the time to bring your attention to that gratitude is really powerful, because it's, when we're doing that, we're actively not spending time looking at other things. And the research does show that people who spend time cultivating that gratitude, do experience, better and more positive outcomes in terms of mental health. So that's a great practice, Felicia.
And I might be off on this. And so if I'm off, just don't tell me, Shannon, that I'm wrong.
Okay.
What about this one? I mean, I know we're surrounded right now in a society of self, right?
Yeah.
Self-care, self-love, self-this, selfish. And I wonder, I would put forward that maybe that's the wrong approach, in part, that we should be other-centered. So, for example, one of my daily prayers when I walk to work, and I walk to work every day, is, Lord, let my life matter to somebody else today. So it's not, let me find myself better today.
Yeah.
Try to get the focus off of myself. And I wonder, are we putting too many messages out there sometimes about self, as opposed to, let's get some focus on the world around us and the needs of others. And if I'm wrong, I'll keep it. But
no, I think, Mike, that's such a great question. And I think it's such a nuanced and interesting question that has to do with so many different intersections in our lives, right? I mean, I think that for some people, and I think I'd put many moms, many caregivers in this, that it's really important to do some care of self. And the airplane, you have to put your mask on before you put someone else's mask on, right? So there's some need to not be completely, to ignore the self, at the service of others. But at the same time, I agree. I think that, we operate best, we thrive as part of communities. If we can connect, I think one of the things that's been so hard about this for so many people is that, people have really been cut up from their supports, cut off from their communities. They haven't been able to go into work or, to church or to places where they find community and be with those who provide them with supports. And so, I think that it's incredibly important to think about the impact that we have and that our actions have on other people. And so I think that's, that prayer, that way of thinking about your, your daily intentions on your walk to work. It's a really nice way of framing that, you're going to be focused on supporting in the betterment of other people and not just on, the betterment of Mike. I think that's really important. But I think it's also important to recognize that can sometimes work differently for different people. So, a woman who's home with maybe 4 young kids, who doesn't have the external outlets that somebody else might really need to spend more time taking care of herself, whereas somebody else might need some help, being aware of others around them in their communities.
Yeah.
So.
Yeah, all in balance, isn't it?
Yeah.
What about this? I saw a question a few times ago. Megan, I see your name. Nope. Um, where did it go? Oh, Amy. Amy, thanks for this question. And I want to get it at this point, Shannon, from the stages of life. So our families get newly the diagnosis. They take a while, then they get on cruise control. And if we all do it right, we can get them to thriving. And then they're doing great. And like Amy is saying, we were doing great, but now our long QT daughter wants to date. Well, that's a whole nother topic. As a
Yeah.
dad, I can help you with that one. Um, and going off to college. So what about these life stage disruptors, that sort of
Yeah.
thing for the moms and dads when they thought they were doing good about it, but now all of a sudden they're anxious and worried again because now I don't have control. They're sending off to college,
Yeah.
will take their medicines, all of those things.
Absolutely.
What do you encourage the moms and dads with that?
It's such a part of parenthood, right? As soon as you feel like you have it, then something else comes and shakes everything up for you.
Yeah.
Amy, I see that you have, you said she'll go to college in a few years, right? So as you're thinking about these next stages, the next stages that are coming up for you or with your daughter, or independence or adulthood, or, near complete self-management of her conditions. So we want to be helping kids at that point think about, as she's going to her doctor's visits, perhaps you're not sitting in there with her. Perhaps she's going, and maybe you're in the waiting room, right? So you can check in and just make sure, at least in the first few visits. But you want her to be able to, to learn and have the practice to go in and say, "Oh yeah, hi, Dr. Ackerman, great to see you. Great. So I'm on 50 milligrams of Nadolol twice a day, or I don't really know how much Nadolol anyone should be on. So never anyone listen to me about that. But so she has the practice of having that independent, conversation with her healthcare provider. Right. And so giving her the practice to do that while she's still at home, while you still have some of that scaffolding there, so that when she goes off to college, which is another slightly more scaffolded situation, she's more independent, but the supports are still a little bit there, right? Then she'll have that practice under her wing. So it's really, as we start to think about moving through these stages, we're always wanting to help kids, give them space to practice being independent within, I sort of think about the way we grow tomatoes, right? You want to have that nice cage around them and the supports there, but you can't hold on too tight or they don't grow, and you won't get a lot of leaves. But if there's no supports there, the tomatoes grow, but then the branches break. It's something in the middle, right? Where you're providing some supports, you're providing that scaffolding, and you're giving them some opportunities to make some mistakes and try things out on their own at all of these different stages with the with the supports there, where Dr. Ackerman can come out and say, or Mike can come out and say, Amy didn't know how much Nadolol she was on. And, so here's some things to talk about. I think we should, be making a plan for transitions. Let's think about what you're going to do in college next year. And so providing those kinds of supports.
As we come towards the close, and I can't believe this has flown by so quickly, I don't want to miss the chance on what if they're not thriving? In other words, I tell all of my patients, if you are not thriving, we have more work to do.
Yep.
The only way I'll know you're not thriving is you have to let us know. So what can the parents be looking for to try to tell whether their child with their long QT diagnosis is or isn't thriving? Some early detail. Obviously, when it's morbid and obvious and terrible, we've lost a lot of time to rescue them.
Yep.
What have you seen in your practice and career are some of the earliest indicators that thriving is just not occurring?
Absolutely. So keeping an eye on things like changes in sleep, right? More than or trouble sleeping, more than just a little bit of, shift around, summer vacation or this, weird COVID time, right? Changes in eating. Things like starting to withdraw more and avoid others. There's some sort of natural developmental things that happen there. Teenagers will naturally maybe spend a bit less time with parents, but if they're spending more time with friends, that's probably okay. But if you notice withdrawal from lots of different sort of social contexts, that's concerning. A change in emotional outbursts. One of the things about this particular period, is that this is a time where it's really important to give ourselves a lot of flexibility and a lot of compassion and a lot of grace, we're going to see from kids just some changes in sleeping, some changes in, some more emotional outbursts. We're seeing, I think we see that with ourselves. I've had some, I've had some emotional outbursts over the period of this pandemic. It's been stressful for a lot of different reasons. But something to think about is, is this something that's persisting? Is this something that's going on for a while? When kids start to really have problems concentrating over a long period of time, or there's a big shift or a big change, or lots of complaints of headaches or stomach aches where there weren't complaints of headaches or stomach aches before, those kinds of symptoms can be a flag that there might be something else going on that's more, that's more emotional and psychologically based.
And then, Shannon, we hear resilience, and that person's really resilient.
Mm-hmm.
Are there like resiliency training exercises that we all can do to improve our resilience and make us more sturdy, that we can withstand and weather the storms better than others?
Yeah, absolutely. You can't be resilient if you haven't had hardship. You can't be resilient if you haven't had challenges. No one's resilient. You're not resilient just walking across a completely flat, smooth plain, right? You're resilient if you can get up over that mountain, right? Or get up over that hill. Make mistakes, fail at things, try things, mess up, and be okay with that, right? The more we practice making mistakes or failing, that's all okay. I'm sure, Mike, as fantastic as a physician that you are, you wouldn't have gotten to where you are if you hadn't made a lot of mistakes in your life. Those mistakes are so important. They helped you learn. I'm sure you made a couple of mistakes that you think back of as major learning opportunities. I know I have those things. Mm-hmm. And so we're resilient when we've made mistakes, when we've had hardships, right? We can help our kids build resilience by giving them the opportunity to try things for themselves, maybe mess up, maybe have a hard time, and being there for them, letting them know that I love that you tried. You worked so hard at that. Having a focus on how kids do, responding to kids and emphasizing their effort, not just the outcome of what they did. You tried so hard. I know how hard you studied on that math test. I saw you studying every night this week. Like, I'm really proud of how hard you worked on that. Even if you're not psyched about whatever the grade is, the grade doesn't matter as much, right? The grade is just the outcome. It's that effort that really matters. And that's where that resilience comes from.
Yeah. Shannon, thank you. And we are at the top of the hour. And I just wanted to say on the sidebar to Dana, I see your question. I'm going to pick that offline with you, Dana, and try to give you an answer through the SADS Foundation. It's a great question, and I'll attend to that. If you don't hear back from the SADS Foundation by Monday or so, will you ping me again? So thanks. All of you on SADS Facebook Live Land, thanks for joining us. Send this program to all of your friends. You don't have to have genetic heart disease to benefit from Dr. Shannon Hourigan. So Shannon, can I twist your arm and have you join us, say, once a quarter, bring you back in 3 months or so?
I'd be thrilled to do that. It's been such a joy getting to know, the families in our inherited cardiac arrhythmias program in Boston. And so I would be honored to do this and be able to speak to families all over the country and all over the world. I saw Ireland too. Hello, I honeymooned in Ireland, so love it.
Oh, lucky. So just in case you're watching right now, Dr. Dominic Abram, my good friend Dominic, you are one lucky person, and your team is very fortunate. So I'm grateful that Shannon could spend this time with us right now. I did, just for everybody as we close, I did offer Shannon a chance to show a picture of her beautiful 3-year-old daughter. She graciously declined. The only reason I did, because I didn't want you to think that only I could do this, everybody. That's
look at that little
picture. Oh,
so cute.
6.5 months old.
Oh my goodness.
That's Aiden. So
that's a joy.
Yeah. And so, when I see her, I go in every night all the time, but for a different reason. No fear, no worry, just filled with love. So, but seriously, back for all of our families, Shannon, you've given some nuggets of wisdom and some practical things that can help all of us sort of make a self-assessment. How are we doing? How are we doing with our diagnosis? How are we doing with COVID-19? How are we doing with our families? Are we where we would like to be? And if not, let's make today the new day to take intentional new steps to, yes, take care of yourself, but think about others. Be grateful for all the things that we do have. We are a blessed people, and fill yourselves up with all the good rather than focusing on the unknown and the uncertain. And Shannon, thank you for helping all of us do that better. And we're going to bring you back in 3 months, okay?
That sounds great. It was my pleasure, Mike. Thank you so much.
And for those of you, have a great week and join us next Friday. What day is that? That looks to be August 21st, where I'll be joined by the Vice President of the SADS Foundation, Dr. Susan Etheridge, a dear friend of mine, and of course, critical to the SADS Foundation. She and I will be taking the top 10 questions that have been given to the SADS Foundation over and over and over again over the SADS Foundation's 25 years, and we will be trying to take those questions David Letterman style. Remember him? Number 10, number 9, and then working our way to the number 1 most asked question is, and Susan and I will do our best going back and forth with those next week. So until next week, everyone, take care and blessings to you all. Bye now. Shannon, thank you.
Bye. Thank you. Take care all.